You're listening to PTAF Podcast, sharing our love of fitness and how we fix pain for many athletes with physical therapy that matches their intensity, so they keep training and stop missing workouts.
Hello, this is Dr. Mandy Vonderhaar, and I'm here with my co-host, Dr. Maddie Martha Betts. Hi, Maddie.
Good morning, Mandy. How are you?
I'm good on this 8th week of quarantine, I think.
I'm pretty sure deep into the 8th week.
Yes. And so when in quarantine, why not start a podcast?
We have used our time very effectively, I think, in coming up with new ideas for this whole entire downtime.
I'm really excited about doing this podcast because you and I have some nerd talks about all things PT, and I always wish that the masses could hear it. So we can teach people how to treat their injuries effectively, the right way, without using any gimmicks or, quick fixes that aren't necessarily evidence-based and proven to work, which really just keeps you spinning your wheels with an injury.
Absolutely. I think my number one goal also along with yours is that the patient feels like they have power over what their injury is or their training, and just never get that feeling of they can't do something or feeling powerless to their injury. So hopefully this is going to instill a lot of confidence that you keep training and intrinsic knowledge of how to modify all your injuries and workouts.
Absolutely. Great. So today's topic is how we fix back pain with deadlifting. So Maddie, how commonly have you had to address this issue with someone? Like, do you have anyone on your caseload right now with this?
I have two in my caseload right now with this. One female, one male. And the male is actually someone who has dealt with long-term back pain, and deadlifts seem to always be the thing that sets him off. He's doing so much better now, but there's still a stigma to a deadlift to him. There's still a little bit of discomfort that comes after some deadlifting with him. So really kind of digging in and getting in the nitty-gritty with that. And that's been a little bit more of a long-term process. And then I have a woman that is in more an acute flare-up currently right now, who's done a little bit more deadlifting at home because of the quarantine. She's using dumbbells and not a barbell, so she's having to go through a greater range of motion, stabilizing two things versus one, and just some of those classic signs that start to show up with back soreness, stiffness, and even a little bit of radicular pain.
Yeah, so we are seeing this right now on our own caseloads, and the reason that we picked this topic first is because it is so common. I think too, what ends up happening, Maddie, is that we'll see people for a shoulder issue, a neck issue, fix that, and then get to the point of, hey, that's better. By the way, my back hurts when I deadlift too. And then we'll end up.
Yes, it's always like the thing that is always there. Or how can my deadlift get better and my back feel better?
Yeah, and I think, we'll have people who think that it's normal to have back pain with deadlifting, and it's totally not normal. It's common, but it's not normal, and there's a lot of things you can do about it, and that's what we're going to tell you today. Okay.
Another thing that we are looking at is kind of general things that happen with deadlifts that could go wrong. And I was just thinking, like, what you're seeing as far as when you look at a client and you're like, hey, can you demo your deadlift for me? What are some of the things that you see happening with a deadlift that might be fixable?
Yeah, I mean, that's a number one. So we could PT it up with these patients and say, hey, we need to work on a little asymmetry here, a little weakness here or there. But if we don't look at form first, we're doing our patients a huge disservice. And our coaches do a phenomenal job of that in class every day. But when someone's having specific pain with a lift, we want to look at what part of that form specifically is causing that issue. And so I really like to look at setup, and then how they're moving through that deadlift and how they finish that deadlift, and breaking it down pretty simply in those terms. I would say the biggest form flaw that I do see is just that rounding of the back or the overarching of the back. And so we'll talk about how to fix that first. So aside from bad form, we also see issues with just intolerance to a load. So too much too soon. So do you have anyone on your caseload like that right now?
I don't know if that's necessarily the problem with my caseload right now, but I do think that my guy that I'm treating, he is a former collegiate athlete. He is as strong as an ox, but he's also almost 40. He works a desk job. So the majority of his time is not spent training anymore. But he's still able to pull the loads that he was able to pull sometimes in college. And so to get in the gym and do that like once or twice a week is just not supplying the tolerance or giving those ligaments and muscles the time under tension that they need to adapt to that. So
maybe he had that tolerance to that load before. And he mentally feels like he's capable of moving that load, and maybe even sometimes physically, but there's these other factors of age. Now he's sitting at a desk all the time. Some of that other category that's playing into it as well.
Exactly.
And let's talk about the stress that's going on during quarantine here. So add stress to that. That can really contribute to pain in itself, no matter how good your form is, no matter how well trained you are, and how experienced you are with the lift. If you've got some other life stressors, lack of sleep, that kind of thing going on, your deadlift can hurt you.
Yeah, all those factors just kind of lead to, if any kind of inflammation is caused from your training, and we're dealing with increased stress with how you handle watching your kids while working from home, even in general, we're not on quarantine, but life stresses, maybe causing lack of sleep, just kind of gets all those inflammation factors driven up. Not only was the deadlift something that inflamed you a little bit, but now life is not allowing you to combat that. So looking at kind of some recovery type things and how your sympathetic nervous system, parasympathetic nervous system is handling that, and addressing some outside factors that I don't think people oftentimes can think about your physical therapist talking to you about, but we have to, is a great place to look.
Definitely. So something we're not going to talk about, I'm going to touch on it right now, but something we're not going to talk about is how unsafe a deadlift is, because it's not unsafe. Inherently, deadlifting is good for you. It's like the best lifting movement you can do, because it's something that you have to do throughout the day all the time. If you're not well trained in deadlifting, then yes, you are at risk of injuring yourself with daily activities, and that is why we deadlift. So I think we're preaching to the choir for anyone who's listening to this in terms of if the deadlift is good for you or not. Yes, it's good for you. We're not going to tell you not to deadlift. It is tremendous for you. And in fact, we actually use it to treat some of our other patients who don't deadlift, who just have back pain. So someone who's not used to training in the gym all the time, if they're experiencing those symptoms of just chronic back pain or an acute bout of back pain, my first question to them is, hey, do you deadlift?
Yeah.
So.
And if their face gets all of a sudden terrified, like deadlifting,
yes,
how to handle that conversation.
Exactly. Okay, so Maddie, what would you say to someone who has been training in the gym? Let's call this person, a seasoned CrossFitter. They've been doing it for a couple years now, at least. They love to be in the gym. They love their workout. And all of a sudden now they've got this intense bout of back pain with their deadlifting. What's one of the first things we tell that person to do to get rid of this pain?
Sure. So kind of looking at it all depends, of course, on the assessment and the evaluation. But from things that we've seen in the past, if you come in and this problem is relatively acute, what we kind of need to do is get the inflammation or that has been caused by some sort of either minor injury to the back or maybe more of a major injury. We've got to get the inflammation heading down so that we are pain-free with simple daily activities. Number one being, can you sleep? Because sleep is so important. I think that that's like my number one marker as to like, okay, so we're going to have to modify a lot of your daily activities and positions and really protect this back for a week or two to just get you to be able to be in the most optimal position to heal and to add activity back in. So this phase may look a little bit restrictive at first, just based on what we do, but we will have you moving immediately because we just have to protect that. And one of the main things that we do is kind of talk about neutral spine, where that is, and how to be in it the majority, if not all of your day. So looking at things like sitting, putting a towel behind your back. If you're laying down, bending your knees, maybe some prone propping if you can't get into a neutral spine right away. But really just being very, very educational about the proper position for your spine, how we can reduce the stress on it through daily life. And we tell everybody, if they know what deadlifting is, everything becomes a deadlift. I want you to move as strictly to pick up your child's toy on the floor as if you were going to pull 250 pounds. And that's just to keep everything super tight, neutral spine, get everything in line. So we're not kind of just picking the scab off of a cut every time we're moving.
Exactly. We're just trying to promote that healing of that tissue without pissing it off again, for lack of a better term. And I think in this phase, I like using this phase as a time to, like you said, educate them about what good positioning is. So even if you know what good positioning is in your deadlift, you can kind of trigger your body to feel that position more naturally by using pain to your advantage. So this is a wonderful phase because you sometimes still feel those symptoms. And so a lot of times what I'll tell patients is, hey, if you feel those symptoms when you move like that, that is your body telling you to move a little bit differently. Pain serves a purpose. And the point of it is not to make you miserable. It's to send that little alarm bell of, hey, maybe you should do this a little bit differently or a little bit less. Your body still wants you to move and it will recover and heal on its own well if you give it a good position and a good environment to do that. And that comes down to a good neutral spine position. But as you said, Maddie, being able to get good sleep and rest, and that is a time when you recover and heal. So if you can listen to those alarm bells a little more diligently during this time period, pay attention to your form a little bit more during this short period of time, and focus on the goal being getting good sleep and recovery, you will fly out of that phase very quickly. And I would say most of the patients that we see, because you're generally very active and fit and healthy before, you don't have a lot of other health issues, you'll be in this, what we call protective phase for like a week or two, if that.
Yeah.
And the more diligent you are about that, the faster you'll fly through this phase.
And I feel like this is where people, like the light bulb really comes on for people. If they can, just kind of wrap their head around being a little bit more careful and listening to the red light of pain and the less pain meaning green light, and just really learning their body and knowing their symptoms, they come out of this, and the next couple phases in their training from this point forward, they really start to intuitively know their body and what they can handle, and it does go a lot faster.
Exactly. So I think what we'll do, Maddie, is we'll post some of the exercises that we like to show during this phase. So, checking that deadlift form with a PVC pipe on your back. And a great position to do that from is a kneeling position. So not even standing, it's a little less taxing on your back if you're kneeling on the ground and working on that hip hinge position. So we really like that exercise. And then just some basic core activation on your back, on your hands and knees, and some basic glute activation as well. And we could do an entire episode, probably a series of episodes on glute activation. So we'll touch on that later.
Yeah.
Okay, how about we talk about, in this phase, we call this the protective phase. So does this mean that people should be laying around doing absolutely nothing, protecting their back, besides PT stuff?
No, it does not mean that.
Yeah, so just because we're telling them to, protect and rest and get good sleep, does that mean they have to sit out from their workouts?
No, I have, and you have tons of ways that we have found that people can stay pretty active even through this phase. And again, once you learn what neutral spine is, and that if you are not experiencing pain or radicular symptoms in certain positions, we can use those positions to get you as active as possible.
Great.
Yeah, Mandy, can you kind of talk about just some of the ways that maybe you could have a client get their heart rate up with back pain so they don't feel like, oh gosh, I'm just not getting anywhere?
Absolutely. So our friend, the assault bike that everyone hates, that is the best way to get your heart rate up during this time period in a safe way and practice good core activation and neutral spine positioning. So you can be on that bike and really be plugging and chugging away, burning calories, sweating it out, but keeping that back in a good protective position that promotes healing. So if you combo that assault bike in a way that looks like normal CrossFit Metcon programming, you can still get a really great workout in. So that bike position is great, as opposed to something like rowing. Rowing may be something that is irritating to that tissue, that is painful, or maybe not. So I think paying attention to those symptoms, and if you can row without pain, then you're probably fine to do it. But if rowing is something that irritates it, the bike is your friend, and then combo that with some loaded movements. And yes, you can lift during this time period if you're in that good position. So we really like a goblet squat over something like back squatting, which tends to load up different parts of your body that may get irritated during this phase. Or we can even do some deadlifting if we change it to a sumo deadlift. So
get a
little
kettlebell in there.
Absolutely. Yep. Little modifications like that. And you can still be moving a ton, still be burning calories, not losing any of your fitness. And that is the beauty of CrossFit, is that there's a million different movements we can do. You've just got to start to make a list of things that aren't painful for you.
Yeah, absolutely. I just even had someone that was a little bit more on the acute side of back pain the other day, and we wrote up an assault bike circuit that was 3 minutes of assault biking. Then she gets off that and she does her bridges, her dead bugs, and a farmer's carry. And she does 3 rounds of that. And that's a pretty good workout. You get your heart rate up. You're making yourself move with tax breathing, perfect form. And she was really sweating by the end. So I think there's definitely ways to incorporate this at all levels.
Absolutely. Great. So if someone has successfully made it out of that phase, so they've protected their injury, they're able to sleep pain-free, they're able to go about their day, they can go to work, they can get dressed, they can do things without pain, which is super important. Then they can move into that next phase of healing, where I think we talk about more movement into a position that maybe before wasn't comfortable, but because we've let some of that healing happen, your body's like, hey, actually this position doesn't feel as bad, and we're easing more into that loaded deadlift position and building strength there at the same time.
Yeah, I think that this phase is crucial in developing confidence in your movement again. I think a lot of times
Yes.
after injury, people are like, I hurt this deadlifting or squatting, so I don't want to add a deadlift or squat back in, and they get fearful of it. And this is the phase where we really can talk to them about mechanics, about the safety of all of these. If you know how to brace, you know what position your spine is in, and just really build that confidence, whether it's starting squatting to a box with no weight, hinging with the dowel on their back, and they begin to really see how therapeutic these movements are for them and how safe they are. And then like just the knowledge of them knowing what muscles hold you there, what muscles are moving you there. Like this phase, I see people just grow so much and improve in their training overall just from phase 2.
Yeah, I think this is where, like you said, they start to realize why maybe they're working out, and the intention behind that hour of fitness that happens every day shifts a little bit. And not for the purpose of saying, well, hey, now I'm never going to lift a heavy deadlift again. But training things around your deadlift and training your deadlift, working on form a little more intentionally, so that eventually when you want to lift really heavy again, you don't have to think about all of that.
Absolutely.
Yeah, so during this phase specifically, we're starting to load up more into that deadlift position. And what that's doing is really making your body more resilient to that load. So the reason that we as doctors of physical therapy know that deadlifting is safe is because the body has the ability to adapt to any position that you put it in if you ease it into that position, if you ease into that load. So that is the process we're going through this second phase of progressively loading bone, progressively loading soft tissue, and as you said initially, Maddie, progressively loading your confidence through this movement.
Absolutely.
So,
yeah. Because what we're trying to avoid, I think, in this phase is the 0 to 100 miles an hour scenario.
Absolutely.
Like someone, just as you said before, like, should we say just don't do anything and then all of a sudden get back to deadlifts? And if we skip this tissue loading phase, it's just going to be this vicious cycle of I deadlift, I get hurt. I get hurt, I rest, and then I go back and I deadlift and I get hurt again. So really this in-between phase is so crucial for just a lifetime of pain-free training.
Yeah. So do you think, Maddie, I mean, I see this all the time. People get overly confident because we have protected and made them confident in how they're moving in that first phase, that sometimes you're overconfident getting here and you're like, okay, well, I can just go lift my max again for my deadlift because my pain is gone. And that's great, but you've got to put the work in to rehab that injury so that you don't end up back at the beginning of phase 1, kind of like chutes and ladders.
Absolutely. You don't want to draw the down the slide card.
Okay. So, after you successfully move out of that phase, the last phase is returning to that full deadlift, not having to think about your form as much through there. And this we see anywhere from 3 to 8 weeks, because sometimes people, if that injury is not too severe on them, they can move pretty quickly through those first 2 phases. And you can get back to this third phase pretty quickly. So, what are maybe some benchmarks that we want to see before someone can go back to, let's say, even 75% of their max for deadlifting?
Sure. So some of the things that we look at are how well you're tolerating some endurance type movements. Like how does your back and your tissue handle lighter weights, higher volumes? So we're typically in this phase 2, you have a little bit of freedom. We're like, hey, let's take lighter weights and move them a bunch, which in CrossFit, I think these are called chippers. And a lot of time in lower weights, higher reps, because muscle endurance has to come before any kind of super strength or power moves. So what we're looking at there is how well you're tolerating 50% and lower, and how your body's responding to that. Also, we want to get you progressively moving up to heavier weights in a very controlled situation. And so a lot of time spent, if you're not doing a workout to get your heart rate up or anything like that in a Metcon, we want you outside of that, really perfecting the moves and doing a lot of accessory work to strengthen the muscles that you're going to be using deadlifting, and adding progressive load to those, and making sure that you are able to keep your core and your hips in the right positions to provide this beautiful rigid spine, hip hinge, and any variance that we could throw at you. And then from there, it's just like we talked about on every phase, just tissue resilience, and making sure that you come to us at every appointment saying, doing good, this is what I added this week, this is what we saw you do this week, and I am continuing to feel better.
Absolutely. Yeah, I think when my patients get into this phase, I want to make sure that we're hitting a point where they have been able to do class workouts consistently without pain, with some modifications that we talked about in phase 2 and phase 1. So can you get through an entire workout without pain when you've maybe restricted your range of motion a little bit, maybe limited the weight without having that flare up of back pain? So we want to see some consistency in those pain levels. And I think what you see in phase 2 sometimes is people think their rehab is going to go like this, but they'll see a little dip, and that is perfectly normal, because we're doing this type of rehab where we're letting you work out and you're moving around and you're trying things, you're dipping your toe in the water to test if it feels okay. You're going to have those dips, those peaks and valleys, and your rehab process is going to look a little more like this. But if you pay attention to those signals of, hey, that workout that I did, it was 2 new things that I tried this time, and my back pain flared up a little bit. So the next time I do that, I'm going to scale the reps down just a little bit, but I'm still going to do that movement, or I'm going to scale the weight down a little bit, and I'm still going to do that movement, or I'm going to pick a totally different movement altogether. But paying attention to those signals, and that's what we're there for, is to guide you through that process, because it is tough. It's tough to pay attention to that when you're not used to doing it. But making sure you're still on that trajectory of symptoms not increasing to a point where you can't recover from it by the next time you work out.
Right. And you're exactly right in saying, like, someone would come in and be like, oh no, I have ruined it. I got this far. I was doing better every week. And then I tried something and my pain spiked and I feel like I'm back to square one.
Yeah.
Huge time to educate. Like, you're not back to square one. We've built so much from here.
Yes.
And that we just used this, as you said, like, we let you kind of go out there and try new things every week, because without finding our threshold, we can never know, and they can never know where the training goes next.
Absolutely.
So kind of, yeah, just like we talked about the pain in the beginning, kind of being that alarm that we can listen and learn and adjust from. Same thing in this level. Got to let them know, like, hey, you're never back to square zero. And that from this point on, this is what we learned. This is how we adjust.
And I think those learning points are those points where your pain does flare up. That is a huge opportunity for learning, so that if this does happen again, you know. And you don't even have to consciously know, but you've taught your body to know. Your body will know, hey, that didn't feel good when I lifted like that. I better fix that and tighten my lats a little more. I better fix that and engage my core a little more. I better fix that and warm up my glutes a little better before I do that next time. Your body will know to do that, because the body is amazing.
Absolutely right. 100%.
So awesome. So, after a patient has gone through these 3 phases and we've high-fived them because they're saying, hey, I don't have any pain with my deadlift, I'm back to lifting the weight that I was, we've successfully rehabbed them. What does it look like now if they're going to go back to deadlifting heavy again?
So this is, I think, where we have the conversation of also adding and progressing load appropriately. And just as if sometimes I tell my patients, you might not have had a surgery, but you had an injury and all healing is the same. So we look at that just kind of like every step of this is a phase or a protocol that we'll follow. So even though you weren't totally out of the game, there was a part of your body that was totally out of the game. So we have to really respect how fast we get back into things. So yes, you're feeling good, but we have to make sure that we're respecting our thresholds. And even if you're in class where some programming is putting you at a 90 to 95% lift, like giving them the confidence to be like, hey, my back hasn't lifted 95% in a long time. So I know that I kind of have to find a new 95% and work from there. It's one thing we spend a lot of time talking about, especially people on programming, really talking to, if it's a personal coach, going to them and letting them know. If they're in a class, I always say, like, hey, go up to your coach and just say, I'm going to do a little bit lighter weight today. This is why. Feel free to coach me, but always give them kind of a heads up. And your coach might have other suggestions that are way better than ours or that you were planning to do. But it's a great conversation to have in any setting.
Absolutely. Yeah, I think the difficult part about being a CrossFitter and treating CrossFitters is that our programming does not look like deadlifting on Monday, benching on Wednesday, you know. So sometimes we'll have done something that looks like a deadlift Monday, Tuesday, and Wednesday. And if we're trying to recover from an injury, if Thursday is a max deadlift day, it's probably not the best time to test the waters there. I think looking at your volume of things that you've done all week, along with how well you've recovered from that workout itself, not just with your deadlift, but how are you feeling overall? Are you feeling like, God, I just got to make it to my rest day? I can't tell you how many times I have seen someone for a new injury, and that was the reason that it happened, is they were just trying to make it to their rest day. So paying attention to pain in your back, but also those signals of, hey, I'm feeling like really beat up and I need a rest day, as well as the volume of things that you've done on your back as a whole.
Exactly.
So awesome. So I think what we'll do, Maddie, is post the exercises that we like for each phase, some examples of those, some of our favorite ones, to our Instagram, to our Facebook, and that way you can see, you know, what are some things that we would do in each phase and how you can work through them and progress through them.
Even if you're using it to bulletproof or warm up before any kind of deadlifting workout or pulling from the ground workout, these are 100% effective. They're the best in the research that we could find and proven every time. So
absolutely. Okay, so we had some questions that people had submitted in regards to deadlifting with back pain. So I'll go through some of these right now. So pinching in the low back at the top of the lift. Why does that happen and how can we fix that?
It's a great question. So I have a couple thoughts on that. And of course, we haven't looked at this person's lift, we don't know, but a couple reasons why you could experience some low back pinching in the top of, so we assume that at the top of the lift, you're getting into more of an extended spine from, hopefully you're staying in a neutral spine the whole time, but we're not always able to counteract any kind of spinal flexion. It's not a bad thing, but as you're coming up out of the deadlift at the top, you're probably coming into more of a loaded extension position. And this could like ultimately be loading your facet joints, which are the tiny little joints between your spine. And if there's just any kind of inflammation in there and they're not real happy, this is kind of the ultimate position of which they would get flared up. So we can look at that and just say, like, maybe there's just some inflammation going on in those joints that we need to deal with, get them a little bit more tolerant to A, a load, and B, some extension. And that comes along with just calming it down with kind of some phase 1 stuff. How does my spine feel in the most neutral mechanics? We call it spine hygiene, just like you would brush your teeth every day. We have to take care of our back every day. And so we go through and talk about that sort of stuff so that we can then progress them into whether it's laying down and doing some extension, then kneeling and getting some extension, standing and loading some extension. Again, just some tolerance to that. What are your thoughts on kind of that question?
Yeah, I think aside from just load management in that position, what is your form at the top of that deadlift? So in the top of that deadlift, have you pulled the barbell up more with your extenders and your back so that when you're standing there, you are more in that extended position that does load your facets no matter how strong your core is. So just making sure you're stacked at the top. And then are your lats engaged? Are you holding onto that bar, or is it pulling you down on your back?
Right.
So just looking at form there could be a quick fix in itself. And then if you still have that irritation, yes, is there an inflammatory process going on that we need to heal from? So.
Exactly.
Okay, next question. Someone wanted to know some back exercises to strengthen her back so that it doesn't spasm with heavy weight. So I think we kind of talked about this already, but this goes back to load tolerance. So I think if you are having a back spasm with heavy weight, heavy is relative to everyone, and heavy for this person, if you're getting that spasm with the heavy weight, is too heavy. Of course, form. Are you stacked in that position so that you're holding it with the right muscles? And then can your body tolerate that load in that position? So Maddie, I really like to give people, static holds through each position in the deadlift. So you can prove to your body that you can tolerate a load at each position for a specific amount of time. So we call that time under tension, and not just at the bottom of the lift and the top of the lift, all the way through. Can you pause at a couple different positions there and hold that load? What kinds of exercises do you like for this?
So I had the same thing. I love an isometric back extension, loading that, getting those muscles, because a lot of times when I hear spasm, immediately what comes to my mind is either that muscle is overworking and something's not assisting it, so it's getting overloaded, or
Exactly.
It's just not strong enough to tolerate what you're giving it. And so my first go-to, again, is yes, let's get some endurance in those muscles, hold that, get used to it in different positions. But my second thought process is, why are your back extensors working so hard when there's at least 8 other muscle groups that could be helping them? And if we can offload that in any way, we've got to do it, because the glutes, the abdominals, the obliques, everything is so important in that lineup. And oftentimes I find that your back is doing maybe 80% of a lift or a brace for spine stability, because the goal there is to hold your spine in a still position. And there's so many muscles that do that, and we're only using back erectors. So I kind of talk to them about having a whole team to do that, and why one player would be really tired and spasming all the time if they weren't helping. And then
overworked and underpaid is what I like to call them.
Yeah. So then getting, of course, into any kind of lateral spine stability, which I find a lot of people are lacking. So a pull-off press, side planks, farmer's carries, and then getting into the rectus abdominis, definitely some hollow holds. Like, let's calm those erectors down. Let your brain know that something else is there to help on the opposite side, so that they're not feeling like they are the only one pulling the load.
Absolutely. And I think a good time to implement those little fine tuners, those helpers, is before you're working out. So then you don't have to think about it so much when you're actually deadlifting. Get those guys, those little helpers, those glutes, those lateral stabilizers to turn on, so that when you deadlift, your erectors don't feel like they have to work so hard.
Absolutely. Throw a lot of confusing stuff in your warm-up, so that when you get to a basic up and down lift, there's nothing that's like, well, shoot, I just did all sorts of stuff that was 80% harder. this is nothing.
Absolutely. Okay. So I think the last question we have time for is, why do I have back pain with Romanian deadlifts? This is a different kind of deadlift. I think it taxes the body in a little bit different way. But Maddie, why would someone have more pain with a Romanian deadlift than a traditional deadlift?
Sure. So Romanian deadlifts require so much more mobility from your hips. And technically a deadlift should be a straight spine moving around your hips. A traditional deadlift, we get to like bend our knees more, so we have one more joint in the system that's allowed to make up for some range of motion. So our hips don't have to move that much. In a Romanian deadlift, where your knees stay in a more extended position, the hip is required to do so much more in that position, and then the back is then required to work harder to stay still. So we ultimately have to then go in and look at what is the hip mobility that we have to form this position, and then how can we get that to where we need to get the barbell or dumbbells to the floor. So it in general is a more advanced deadlift, and it requires a lot more hip mobility, hip stability, back strength. And also, if we're looking at anything like balance, your whole entire body has to stabilize. Ankles, knees stay still, hips, back move. And that's just a really hard thing for our brain to conceptualize sometimes. But ultimately, it does load your lower back a little bit more.
Yeah, that's the biggest problem I see with it, is that it is a bigger range of motion for several joints. And so that is a bigger stability and control activity for all these joints together. So there's a little less room for error.
Absolutely.
Awesome. Well, I think that's all we have time for today. And we nailed it. We did an hour.
I think that we thought that we could not keep it in an hour. So
I
I'm really proud of us.
I know. I'm excited. I must not have drank enough coffee.
I got up and worked out this morning, and I'm loaded on pre-workout and all sorts of stuff. I was like, I can't drink coffee. I might not stop talking.
All right. Well, I think our next episode, what we should talk about is getting people back into the gym safely. As gyms start to open up, a lot of people have not done a pull-up on a pull-up bar in a long time. They have not deadlifted really heavy weight in a long time. So I think having that discussion would be really helpful for a lot of people. So we shall go there next. So until next time, Maddie, thanks for joining me on the PTAF podcast, and we'll meet again.
That sounds like a great plan, and I can't wait to get together back with you, and I can't wait to get back in the gym and have a safe plan for all of us to return.
I know. Yeah. So by the way, Maddie is back in the gym taking patients. I'm still doing virtual visits. Maddie's still doing virtual visits too. So we can help you at home. We can help you at the gym. We're here for you. All right. Thanks, guys.
This podcast represents the opinions of Dr. Mandy Van Hard, Dr. Martha Betts, and the guests to the show. The content should not be taken as medical advice. The content is for informational purposes only, and because each person is so unique, please consult your healthcare professional for any medical questions. While we make every effort to ensure information we are sharing is accurate, we welcome any comments, suggestions, or correction of errors. Privacy is of utmost importance to us. All people, places, and scenarios mentioned in the podcast have been changed to protect patient confidentiality. This website or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing standard of care in a legal sense or a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or website. In no way does listening, reading, emailing, or interacting on social media with our content establish a doctor-patient relationship. This podcast is owned by Affiliate Physical Therapy, LLC.